Hello, so your baby's 2 to 6 days old and your milk's come in, but your breasts feel hard and painful. This is called breast engorgement. Engorgement can happen anytime you're lactating. It can be caused by inadequate drainage of fluid and happens due to a number of reasons, including stress, latching issues, or even during weaning. The problem with engorgement is that the swelling in your breast can decrease milk flow and more congestion builds up, leading to breastfeeding issues like increased pain, which can make it hard to focus on your baby. I'd like you to think of engorgement as the water under a bridge. The bridge represents milk ducts and cars represent the milk. If you keep trying to empty the breast, more cars will come onto the highway, further reducing the milk flow and causing further inflammatory congestion, which includes the water taking over the bridge. If you don't put any more cars on it and instead decrease the congestion by calming the inflammation with techniques like cold compress, your body can reabsorb the milk and the discomfort and engorgement will down-regulate. So not treating engorgement can lead to mastitis, which is now known to be influenced by hyperlactation and/or an imbalance in the mother's biome, among many other factors. This can be a recurring issue, so it's important to get a handle on reducing the congestion in the breast with the proper tools I'm going to show you today. Research has shown there's many benefits to using cool compresses to decrease swelling and inflammation, and even warm compresses have their place in short applications, especially if you think feel it's comforting. When you use the cold compress, you'll want to have some ice in a bag or even a peri pad from the hospital soaked in cool water and frozen. You can also use a little diaper because they're really accessible. Make sure you wrap it in a cloth to reduce the risk of skin damage and apply it for 10 minutes every 30 or as needed. Do not exceed this to reduce the risk of skin damage and prolonged vasoconstriction. Clean cooled cabbage leaves also count as a cool compress. You can put them inside a well-fitted bra for about 20 minutes, but remember there is the risk of decreasing your milk supply because of the prolonged vasoconstriction. Even though cold therapy slows soft tissue swelling temporarily, the recovery process is still dependent on your body's ability to cope with inflammatory stress. Using the BAIT acronym, ICE is just one part of the toolkit. We recommend breast rest, so not overfeeding, pumping, or massaging, Advil, ICE, and Tylenol. It's important for us as healthcare workers to recognize we're living in a diverse ethnographic landscape, and it's ethical to offer alternatives. For example, in the Chinese culture, in the 1-month postpartum period, it is called doing the month, or 坐月子. A central part of the postpartum care at this time is that many times the mother is taken care of by elders, which is a traditional practice, and it stresses that cold is to be avoided as it makes the mother susceptible to illness, and being warm is the utmost priority at this time. Sometimes it can be as strict as staying indoors for most of the month, avoiding drafts, or not even bathing or washing. From my own experience, it would be very stressful to disagree and disrupt social harmony at this vulnerable time, and causing more stress to the mother is contradictory to our ethical framework and delays beneficial treatment. This is where we would offer different tools. Out of respect for diverse cultures, it would be ethical to offer a warm compress. The main principle is that if it provides the mother comfort, a warm compress can be used for short periods, but it needs to be properly explained that the heat promotes increased blood flow, which can worsen the swelling in the breast. So some studies have actually shown that the plant hollyhock combined with a warm compress results in the rapid improvement of breast congestion. And another study found that hot ginger compress is more effective than a hot compress alone in reducing breast engorgement associated pain among breastfeeding women. How this works is it improves the oxygen and nutrient circulation, encourages tissue healing, and the heat reduces pain signaling. So not only that, but ginger and hollyhock have been proven to show anti-inflammatory and antibacterial properties. It's also helpful to know that in one study in Taiwan, it was found that certain Chinese medicines have anti-inflammatory and analgesic effects for treating mastitis, similar to Western medicine. As always, if you do develop a fever, red streaks, or symptoms don't resolve after 24 to 48 hours with application of the tools that I've shared, please don't hesitate to contact a lactation consultant or your local public health nurse. This concludes my presentation. I hope that this presentation gave you some ethical tools, techniques, and diverse benefits and risks with using hot and cold compress. Thank you.